Act 1. The Bitter Pill. December 2011, Lahore, Pakistan. On a cold morning at the Punjab Institute of Cardiology, hundreds of impoverished heart patients received their free, government-supplied medication. For them, it was a lifeline. They trusted the doctors. They trusted the state. They had no reason to believe they were being systematically poisoned. Within days, the first victims began returning to the hospital. They came with terrifying, unexplainable symptoms: uncontrollable bleeding from the mouth and nose, a strange, dark mottling of the skin. Their immune systems were collapsing. Baffled doctors initially suspected a rare, aggressive strain of dengue fever, but the patients were all from the same cardiac ward, and they were all dying. As the body count climbed past 50, then 100, then 200, a citywide panic took hold. The investigation, now a desperate race against time, finally found the source. It wasn't a virus, it was the heart medication, a drug called Isotab. Lab tests revealed the pills were contaminated with a massive overdose of an anti-malarial agent, a toxic combination that was systematically destroying their patients' bone marrow. The cure had become the killer. This wasn't an isolated incident. It was a glimpse into a daily, silent massacre happening across the globe. Experts estimate that substandard and falsified medicines kill more than 250,000 children every year from treatable illnesses like malaria and pneumonia. The total death toll may approach 1 million people annually, a statistic that remains tragically imprecise because the evidence literally dissolves. It's a plague hidden inside a cure, a perfect crime where the victim is blamed for succumbing to their disease, and the murder weapon is simply thrown away. For years, a small, dedicated group of investigators have been fighting a war in the shadows against the invisible enemy, men and women from organizations like Interpol and the World Health Organization. They aren't just fighting crime, they're fighting a public health catastrophe that thrives on desperation and poverty, exploiting the gaps where government oversight is weak and borders are porous. Their work is a global game of cat and mouse. 1 month, it takes them to the sprawling industrial zones of China for a series of coordinated raids codenamed Operation Storm. Kicking down the doors of clandestine labs in Guangzhou, they found workers using industrial presses caked in filth, mixing powders with everything from harmless cornstarch to toxic yellow highway paint for coloring. In a single sweep across 7 countries, they seize over 16 million counterfeit pills, fake antimalarials, inert HIV drugs, even bogus rabies vaccines that were nothing more than sterile water. Each seizure prevents countless deaths, but it's like trying to empty the ocean with a bucket. The criminal networks are nimble and decentralized. For every lab they shut down, 10 more spring up. The scale is staggering. Analysts put the value of this illicit trade at over $200 billion a year. That's a figure that rivals the global narcotics trade. But unlike cocaine or heroin, this product hides in plain sight, on the shelves of pharmacies, in the warehouses of hospitals, and in the medicine cabinets of unsuspecting families. It mimics the very thing we turn to for healing, transforming a symbol of hope into an instrument of death. How does this happen? How do criminal syndicates control a supply chain that stretches from Chinese chemical factories to African villages, often using the exact same shipping routes as legitimate goods, all without leaving a trace? To understand how this happens, you have to follow the money into the heart of a hidden multi-billion-dollar criminal empire. But these raids only scratch the surface. To truly understand the scale of this empire, you have to go inside the factories where death is mass-produced, and what investigators found there is more terrifying than you can imagine. Act 2. The Poison Factory. This empire isn't built on gold or territory. It's built on powder and presses, in the backrooms of a global shadow economy. When Interpol agents raided a repurposed factory in Guangzhou, the scene was one of industrial-scale deception. These weren't sterile pharmaceutical labs. They were filthy garages where rats scurried across open sacks of filler powders, and the same unwashed bucket was used for mixing different drug batches. Cross-contamination wasn't a risk, it was a certainty. Antiquated pill presses, caked with the residue of a dozen different fake medications, stamped out tablets that looked, felt, and weighed almost exactly the same as the real thing. It's a business model perfected by entrepreneurs of crime. For months, an undercover agent had been posing as a buyer, communicating with a man who called himself the Professor. His real name was Kevin Xu, and from his base in China, he ran a global one-stop shop for counterfeit medicine. In secretly recorded conversations, Xu boasted he could copy anything, from the flu medication Tamiflu to the blood thinner Plavix. His network produced not just the pills, but the sophisticated packaging to match. Blister packs, boxes, and forged holograms so convincing they could fool a trained pharmacist. The question was always why? Why take such a risk? The answer, found in seized ledgers and offshore bank accounts, was terrifyingly simple. Profit margins that dwarf the narcotics trade. According to Interpol, a kilogram of heroin might net a trafficker $20,000, but a kilogram of cheap chalk powder can be pressed into 10,000 counterfeit pills, sold at just $2 each. That's the same $20,000 with a fraction of the risk. A fake anti-malarial tablet costs 5 cents to produce and sells for $1, a 20-fold return on investment. As one United Nations report put it, this trade offers the high reward of drug trafficking with a comparatively low risk of detection or punishment, because offenders are often charged with minor intellectual property crimes, not mass murder. Once manufactured, the phantom dose begins its journey. Let's follow one shipment. It begins not in a hidden lab, but in the vast open-air chemical markets of Yiwu, where a trafficker illegally buys barrels of white powder. That powder is then driven to an unmarked warehouse in Henan province. The finished pills are packaged separately from the boxes, often shipped at different times to different ports to avoid raising suspicion. The key to their success lies in exploiting the gaps in global trade. A container filled with fake antibiotics leaves India, not heading directly for its final destination in Africa, but for a free trade zone in Dubai. Inside this legal grey area, with minimal customs oversight, the container is opened, the pills are repackaged, the shipping manifests altered. These zones are logistical black holes, processing millions of containers a year with an inspection rate that can be less than 1%. What arrived as a nutritional supplement from India now leaves as veterinary medicine, bound for Europe before being rerouted again to West Africa. By the time it lands, its origin has been deliberately and completely erased. This intricate web is managed by operators like Meenakshi Sundaram, dubbed the spurious drug kingpin by Indian media. Sundaram wasn't a street-level dealer. He was a wealthy trader from Chennai who built a $6 million empire primarily by relabeling and selling expired medicines. When the authorities finally caught him, they didn't find a back-alley chemist. They found a man with 3 lavish houses, luxury cars and dozens of properties. A fortune built on the suffering of cancer patients and diabetics who trusted the medicine he sold. Sundaram's success reveals the network's terrifying adaptability. It isn't just an underworld problem. The greatest danger lies where the criminal supply chain bleeds into the legitimate one. Corrupt pharmacy owners buy fake stock at a discount to sell at full price. Hospital administrators, tempted by bribes, allow counterfeit cancer drugs to be mixed into their official inventory. In 2022, an Iraqi government contractor was accused of doing just that, systematically poisoning the national hospital system from the inside. This is the ultimate endgame for these syndicates. Not just to sell their poison on a street corner, but to place it directly in the hands of your doctor. The infiltration of legitimate hospitals was the syndicate's masterstroke, but it reveals a deeper, more systematic problem. Because the criminals aren't just exploiting the system, they've become part of it, and the story of how that happened reveals a catastrophic failure at every level of government and law enforcement. Act 3. The system failure. Remember the 200 victims in Lahore? The official investigation eventually revealed the factory responsible, Efrose Chemicals, had been operating on an expired license. A simple piece of paperwork ignored or paid to be forgotten became a death warrant for hundreds. This is how the system is compromised from within. This isn't a story about a few bad actors slipping through the cracks. It's about a system so full of holes, it's more void than barrier. The counterfeit trade thrives on a simple, brutal equation: high profit, low risk. And that calculus is made possible by the first and most corrosive systemic failure: corruption. We spoke to a former drug inspector from Lagos who asked that we protect his identity. Let's call him Adeyemi. He described his job as trying to plug a fire hose with a teacup. He told us about the day he seized a container full of fake antimalarials at the port. He filed the report, celebrated a small victory. By the next morning, the container was gone. The paperwork had vanished. The port authority had no record of it ever being there. The bribe had been paid, he said, his voice flat. And I knew if I pushed it, my family would be in danger. A patient's trust in their doctor or nurse becomes the counterfeiter's greatest asset. Government contracts are awarded to suppliers who mix fakes into legitimate supply chains. It's a betrayal at every level, turning halls of healing into marketplaces for poison. But where corruption doesn't succeed, legal loopholes provide a safe harbor. Criminal syndicates study law books with the same intensity as prosecutors. They know that for decades, many nations treated pharmaceutical counterfeiting not as a violent crime, but as a minor trademark infringement. Before 2009, the maximum sentence for making fake drugs in India could be as low as 5 years. The criminals made a logical choice. Why risk a life sentence for trafficking heroin when you can make the same money selling chalk pills with a fraction of the risk? International agreements like the Medicrime Convention, designed to criminalize this trade globally, have seen painfully slow adoption across Asia. The continent's manufacturing hubs, including powerhouse producers like India and China, remain outside the treaty's reach, creating a fractured legal landscape that counterfeiters exploit with surgical precision. They use free trade zones as legal black holes, places where shipments can be rerouted and relabeled with minimal oversight. A container of fake antibiotics leaves a port in China, passes through Dubai where its papers are changed, and lands in Africa as legitimate medicine. Each stop is a legal firewall, making it nearly impossible to trace the shipment to its source or prosecute the kingpins. Even where the laws are strong, the enforcers are overwhelmed. The Interpol agent we spoke to compared it to fighting a hydra. We're not just fighting people in labs anymore, he told us. We're fighting sophisticated e-commerce platforms, dark web marketers, and encrypted payment systems. We shut down over 113,000 illicit pharmacy websites and links during Operation Pangea in 2021. It was a record, but the next week, new sites are up, selling through encrypted apps like WhatsApp and Telegram. They've decentralized their entire sales model. In response, the pharmaceutical industry has tried to fight back with technology, pouring millions into secure packaging, color-shifting inks, tamper-evident seals, and complex holograms. But they're in an arms race with an enemy that has no rules. Imagine you're a forger in a Shenzhen workshop. A new hologram from Pfizer hits the market. Your job is to crack it. Within days, you have a sample. You analyze the layers, the microprinting. A week later, your factory is churning out tens of thousands of near-perfect copies. The billion-dollar corporation's latest security feature has just been defeated by a $100 scanner and a skilled technician. This is the grim reality. Widespread corruption that welcomes the poison in, weak, outdated laws that barely punish the offender, and a hopelessly outmatched global enforcement network fighting a multi-billion-dollar industry with a shoestring budget. The system we built to guarantee the safety of our medicine wasn't just compromised, it was never truly designed to withstand an assault of this magnitude. It is fundamentally, tragically, broken. And a broken system doesn't just fail, it creates a global contagion, turning medicine itself into a vector for disease. Act 4. The global contagion. The poison brewed in an Asian lab doesn't stay there. It travels. A fake rabies vaccine, little more than mineral water, kills a 5-year-old boy in Guangzhou, China. The same business model sells contaminated cough syrup from India that causes mass kidney failure in Gambia, killing at least 70 children. In Panama, it's a government-distributed cough syrup, tainted with industrial-grade diethylene glycol from a Chinese factory that kills over 170 people. These aren't isolated incidents. They are nodes in a single, interconnected web of death. The supply chain isn't a separate criminal underworld. It's a parasite, intertwining with legitimate channels, turning hospital dispensaries into vectors of death. For the families in Lahore, this global network isn't an abstract concept. It's the reason for the empty chairs at their tables, for lives cut short by a simple pill that was supposed to heal. Justice for them isn't about shutting down one lab. it's about dismantling an empire. But on the front lines, a new kind of war is being waged. In Nigeria, Dora Akinyili, the head of the country's drug agency, turned the tables. She knew she couldn't win with raids alone, so she partnered with tech companies to put a scratch-off panel on medicine packets. Now a patient can text a unique code to a short number and get an instant reply, okay or fake. Suddenly, 100 million cell phones became a nationwide counterfeit detection network. Global logistics firms are testing blockchain ledgers, impenetrable digital records that could make every single pill bottle traceable from factory to pharmacy. But deploying such a system requires a level of global cooperation between rival corporations and governments rarely seen. This is the new arms race, technology against deception. Yet, even as technology offers hope, the syndicates adapt. They shift their focus to unregulated online pharmacies, targeting first-world customers in the US and Europe with fake lifestyle drugs like Viagra or Xanax, pills that are now being found laced with deadly fentanyl, turning a search for a cheap fix into a death sentence. The war against counterfeit medicine isn't just about crime or regulation, it's about trust. The single greatest vulnerability these criminals exploit is our blind faith in the pill bottle, the doctor's prescription, the pharmacy's white coat. They have weaponized our trust against us. So go home, open your bathroom cabinet, look at the bottles and blister packs that hold your health, your life in their balance. The question isn't just what's really inside, it's who do you trust more? The global pharmaceutical system that has proven to be so tragically broken, or the criminal empire that has learned to mimic it so perfectly? Exposing the truth behind powerful industries is what we do here at Generation Y. If you believe in pulling back the curtain on the systems that shape our world, from what's in your pet's bowl to the algorithms controlling your feed, then join us. Hit subscribe and ring that notification bell, because the next hidden reality is waiting to be uncovered. Cheers.